Welcome to One Training, where we provide health and fitness content to help you achieve your goals. Choose the fitness course Professional Athletes Trust. Click the link in the comments to learn more. We've discussed in the past videos about pre-screening and why it's important and so forth. Let's just do a bit more of a deeper dive into the pre-screening. So on my screen here, we've actually got the most current version. That's very important to know because this does actually change every few years. So it is important for trainers to keep up to date with the most current one. If they're using an old one, it's not based on the most current, health and medical guidelines. So the first part of the pre-screening is stage one. So as you can see, it is compulsory. And there's information about why. A lot of clients will say to you, "Oh, why are we doing this? So I just want to rip in and start training." But there is information there that you can just pass it over to the client if you don't want to read it. You can actually just say to them, or you can verbalize it about why it's important, because we all know that if the client understands why you're doing something, they're going to have more buy-in. So the first part in stage one, as I said, it is compulsory. And the way we look at this is it's more of these high risk things, and a lot of these things as well. Unfortunately, they're not as tangible. They're not things that we can just improve overnight. These things are chronic, which is long term. So you've got things about if you've ever had a diagnosed heart condition or a stroke. So it's no judgment here. It's just more things that we really need to filter out, because with these high risk things, these clients shouldn't just be coming down to your boxing session, start jumping in. They really should have a plan, with their GP that they bring to you, and you can train them in a safest way possible. So for stage one, as you can see, with colours nice and clear to see. If there's any questions answered yes, then that is an automatic referral to an appropriate, normally a GP 9 times out of 10. But if it is more of a specialist thing, it could go to a specialist, or if it's a physical thing, for example, one of those questions there, number 6 could be to a physio or a sports doctor. So they need referral, and then the idea would be they would come back to us and would have guidelines from the doctor. And at the end of the day, it's going to help us write their program. If we've got advice from their doctor giving us, from a highly qualified person, giving us step-by-step advice and guidelines, and that makes our program a lot easier to train the client in. Next part, if there's a client answer no to all 6 questions, then they can go down to question 7. So they might have answered yes to, might answer no, sorry, to all the questions, but it doesn't mean that they're just simply, sweet, they're all good to go. There are a lot of other factors that we do need to consider before we write their program. It is called personal training for a reason. So here we've got, it's really important we look at their current exercise levels. So there's no good being a former professional rugby player if you've been sitting on the couch for 5 years. So it's really important to know what they're currently doing, to see, if the car has been sitting in the garage, it's actually been, moving around and going pretty well. So, and here, this allows us to sort of see, what also intensity they're doing. So, and it gives us guidance on, well, are they just doing a walk every day, which is great, but all they are doing, a bit more, activity. And again, it's not just about high risk. This will also allow me to see if I've got someone who's training in the vigorous high category, then I might not even do stage 2 because it's not compulsory. I might, this person's an athlete, I'm going to change their program as well. So you're always sort of looking at that. Two more figures that go with stage 1 is it's important to sort of follow this flow diagram. People will just see with lots of clients, it might take a lot of, they might be very busy. So it's important for them to visually see. Do they answer yes to any question? No, what do I do? Yes, what do I do? For trainers as well, but also for clients as well. They can see that, these are the guidelines from the governing body. You're doing your job as a professional, you're following the best practice. And another really important one, which we'll get to more in our exercise programming, is the intensity guidelines as well. So next part of the pre-screening is stage 2. I'm going to ask experienced personal trainer Chris to go through stage 2, what you do with clients and why it's important.
Okay, so stage 2, the first thing I'll kind of frame up for you in comparison to stage 1 is, so ideally they've answered no to every question. They've given us some information on on their current activity, how many days, how long they're exercising for, at what intensity. Okay, so we have a good idea already of at what level of risk they're at, and it also gives us some general framework to start programming with. Okay, so we've already got it in our mind. Okay, what kind of point we're at with this person. But when we look at stage 2, so this is where we're identifying risk factors. Okay, so in how this is different to stage 1. So in stage 1, those questions, if we're answering yes to them and we're telling the personal trainer who's conducting the consultation with us that yes, we have these conditions. Okay, so and that they are often going to be permanent. Okay, there's not a lot we can do about if you have things like type 2 diabetes already, if you've had surgery in the past few months and had a triple bypass, or you've had a knee reconstruction, things like that. Okay, those things we can't do too much about, but by assessing any other risks aside from that, okay, even if we have a clean bill of health, it just lets us know if there are any things that could potentially go wrong or harm us while we're exercising. All right. But again, I don't want to be all gloom and doom in terms of this stage, because it's important to also remember that a lot of these, the first 2 questions are probably the 2 examples, the 2 exemptions, but the rest of these questions you can very much change or do something about. Okay, and I'll talk about why. So your first 2 questions are 8 and 9. Okay. Relate to age being a risk. Okay, and obviously there's a cutoff point for males and females, and this is the only reason this is a question and this is a risk is because it's common that after as we age, as we get older, we are more prone to certain health conditions, or just having a health decline as we age. Okay, it's not saying that you are absolutely done and dusted, but it's just saying that there is a risk involved with aging and health related conditions. That's all. Okay. The same goes for if you've got a family history of stroke or heart attack. Okay, there is a lot of research and evidence to show that if your grandparents, parents, uncles and aunts, people around you and your family, if they have these conditions, it is very likely that you might get them as well. Okay, and also this risk only really applies if they were diagnosed or these things happened before the age of 55. Okay, and that's mainly because it is fair to say that would be a hereditary condition. Okay, so if for example, if your parents or grandparents had a heart attack at 56, okay, it doesn't mean it's not a risk, but it's also saying that it is less risky because it was potentially diet induced or health induced, that sort of thing. Okay, as a general. But if we look at just kind of briefly go over the rest of the questions from 10 down. Are you a smoker or not? And have you quit in the last 6 months? Okay, you can very much change that. Our body composition. So can we lower our BMI and our weight circumference? Absolutely. Okay, because these type of figures or results present a risk. Do we have high blood pressure? Are we on medication for these conditions? Things like high cholesterol. We can all very much do things to change or lower these figures. Okay, and if we do, we are then considered lower risk. Okay, so that's what I was referring to earlier with the first couple of questions, is that even though we might look at these as something significant, okay, they can change, and we could maybe work on some of these things via an exercise program and some other health preventions for 3 months or so, 3 months or more. Okay, and we can lower your high blood sugar and help you control that better. Again, you could potentially come off certain medication. In 12 months, you haven't had a hospital visit for some sort of injury. Okay, or it's been 12 months since you've had a baby, things like that. Again, these are all things that can shift and change. Yeah, over a significant period of time, at least. Okay, so this second section is less about identifying, what conditions are permanent. This is more, all right, what are our risks? And therefore, as a trainer and the client understands, okay, these are things I want to work on and change. Okay.